as I say, Tanzania has a population of about 40 million people, and out of those we have approximately 6,500 health facility to serve those 40 million people. And this is not a good match considering the ratio of facility to the population. But the median age is approximately 18 years, the median age. So you can see the population as mostly the teenagers or the middle age, the people from 16 to 18 to 25. So with the dynamic technology changes, especially in mobile technology, there's a need for the government to look in a different way to deliver healthcare system. So the ministry has taken a little time and look around and see, well, there's a need for mHealth initiative to start using mHealth programs and application to deliver a good healthcare system. Well, the Ministry of Health is basically taking the leadership, it's taking the lead role, and the lead role is due to the fact that the ministry has recognized the impacts that mHealth can bring in improving the quality of healthcare, enhancement in developing and retaining qualified and well-motivated human resources, and use of evidence-based decision-making. And as I've said before, the major role that the ministry would like to play is just to harmonize and coordinate. Those two things, please keep in mind, that not just control, we are not really looking on control, but to harmonize and coordinate mHealth programs around the country. And the major issues that we really like to coordinate and harmonize is issue of interoperability, sustainability, scalability, and ownership. We like to see programs that are scalable, programs that are sustainable, programs that they have data interoperable, and the programs that are sustainable. So for all the people that are running the mHealth programs, these are the things that we're probably going to emphasize more on. How is your project scalable? How is your project sustainable? How is your project interoperable? And how can we take ownership of some of the information? As I said, Ministry of Health and Social Welfare is taking the lead to improve the responsiveness and reach with a focus on at-risk and marginalized population. As we say, the key initiative is a national rollout of the district health information system. We have DHIS2 right now. It's rolled out in Pwani. We are going to the next 5 regions right now, which is Dar es Salaam, Shinyanga, Dodoma, Manyara, Lindi, and Mtwara probably. But this DHIS has played a critical role in evaluation of health sector reform in the country. There's a lot of animation and the XP is not working well. And the ministry also has often worked in partnership with other government institutions, NGO, and private sector. The major concern of the ministry is to improve access to all Tanzanians to quality health care and social welfare. And as I said before, our main job is to work on a policy and program implementation and monitoring and evaluation of existing initiatives. And as you can see, that we have various people working with the Ministry of Health. We have University of DG, CDC, USAID, we have mobile company Airtel, Zantel, Vodacom, Tigo, all those are partners in our new public-private partnership that we're trying to create to try to bring people together and try to have programs that are scalable, sustainable, cost-effective, and they bring data that are interoperable. And within the ministry, actually, I'm sorry, not within the ministry, there's, I don't know if you all know that there's a community of practice. It happened, I think, like 2 years ago that most of these small programs, they are running programs independent. And they decided to create a community of practice that where they can share experience, they can share challenges, they can share a lot of stuff that they want to attain. And the ministry has taken a leadership to organize and collaborate and lead the community of practice. And the community of practice actually is led by the Ministry of Health, but is co-chaired by D3. It's a private company that is co-chairing the community of practice. And there's over 90 members from over 30 organizations. And the members are coming across from the government institution, coming from the government sector, from private sector. And what we do, we have regular meetings, and the purpose of those regular meetings is to share information, as I said before, work together and address challenges facing mHealth in Tanzania. And most of the major issues that we are talking through within our community of practice is interoperability, strategic planning, moving from pilots to scale up, as I said, scalable programs, and communication. How can we ourselves communicate and probably share some of the information? You know, if you're collecting patient's ID, I don't have to collect the same patient ID. I can just go and share those patient's ID. If you're collecting a number of health facilities, I don't have to go again collect a number of health facilities. Somebody else is doing. So those will bring interoperable data, and we can share all those information and make our programs cost effective. You know, you don't have to spend money on collecting the same information that somebody else is collecting. And these are a couple of workshops which were done in Dar es Salaam and Bagamoyo. Now I'll come to talk about a little bit how we define mHealth. There's a various definition about mHealth, but mHealth itself is the use of mobile communication technology, such as mobile phones, PDAs, to assist in the provisioning of healthcare services and information. As I said, services and information. Advantage of mHealth. There's a real-time data. Now, one of the challenges that the Ministry of Health is facing is how can we collect the most valuable information from health facilities, especially those most remote areas, to the Ministry of Health Central Database, where we can work on the policy changes, improve health services, make changes in human resources. We're not collecting that on real time. We are getting them at the end of the year, and some of the information are too late to work on. So with the use of mobile phone, there's an opportunity for us to get a real-time data. You know, somebody, as we all know, there's a huge penetration of mobile phones. You know, so we actually know at least somebody has a mobile phone at the most remote area, so we can get those information which is needed to the ministry at real-time data. I'd like to share a couple of mHealth projects in Tanzania. We have disease surveillance. We have logistic, telemedicine, clinical decision support, health messaging, community health workers. There's more. There's more than that. But those are the few that of the health projects, mHealth projects currently in Tanzania. And who are doing these mHealth projects? As I said before, we have the government of Tanzania, we have JSI, we have a lot of public-private companies that are working through mHealth program. Probably some of you are doing the same thing. And this is the mapping of mHealth projects. Where the mHealth projects are. You can see there are some of them there. Let me see, this has some animation supposed to come with themselves. We have mHealth projects in Mwanza, We have some of them in Dodoma, Mwanza, Zanzibar, Pwani. We have mHealth projects here currently running in Lindi, Mtwara. We have a lot of mHealth projects, and none of them currently has been scaled up to a national project. So our role right now is just to look at them, going through one-to-one, and see how can we make them scalable and benefit the citizen of Tanzania. And we have this, I would like to give introduction of a public-private partnership. Well, the public-private partnership actually sets up a community of practice members and non-community of practice members with the private sector also. Our main aim is to work to support sustainable and scalable public health programs, combining expertise and resources, making extreme good use of the booming mobile phone infrastructure in Tanzania. And we have good examples on some of the projects that the ministry itself and the private company that they have implemented. One of them is we call IDSR, Integrated Disease Surveillance and Response. This is an IVR program that uses integrated voice response, that where you call and report about diseases of public importance, diseases of diseases that are like cholera, diseases like measles, a lot of diseases that have a public interest. As I said, integrated disease surveillance and response disease system. We have a core indicator reporting system. We would like to know the core indicators. So that we have some indicator that really define our performance on the health sector. We would like to get them on real time. So we have a core indicator reporting system. And we have some activities. One of them is National mHealth Strategy Framework Development. And we plan to create an mHealth strategy where we all, as a community of practice, agree upon it and work towards it. So we have private sector partnership cultivation. As I said, we are trying to create an environment that private sector they can join the ministry, especially the government, and work together and make national programs. And one of the examples of the IDSR, how it works, actually it consists of health community worker making a free call to a server, and then a Swahili voice recording ask reports, and after voice interaction with the system, then the system records the data on the server, and if that disease needs a response, then people who has to work on those response will get SMS response, will get some calls regarding, let's say there's a cholera outbreak, and then a person at the facility, they don't have to call anybody, they just call the system and just tell the system that there's a cholera outbreak right here, and then there's the people from the district to the region up to the national that they get the message about the outbreak of the cholera. And then all those people, they know their roles. They have to mobilize resources and respond to the cholera. This is something different. Before that, people used to record on the papers, try to catch a bus, take the paper all the way to the district. Some of them, they are like 200 miles, 250 kilometers away. They have to catch a bus and go report to cholera. By the time they reach the district, there's 10 people, 20 people outbreak out there. But with the use of mobile phone, right that way, people got the message that there's a cholera, and people will act immediately. So this is one of the examples of the program that the ministry is working on.